Benji, what's up, man?
Okay, let me get my audio set up.
Oh, you can't hear me?
Let me see what's going on with my audio. Maybe I gotta connect my headphones. Sorry about that. Might just be pulling out the big old headphones here.
That's all good.
It's a new software. I haven't seen this yet.
Oh, yeah, it's good stuff. It's really
Still
good
can't hear
stuff.
you 1 second. Still loading. Give me a second here. Okay, I think I hear something.
Yeah, you got it?
Perfect.
There we go. Benji, what's up, man?
Hey, how you doing, doctor?
So you just got back from work? Tell me what's going on.
Yeah, so great to be on here again. I remember we recorded our first podcast. I attempted to launch a podcast for oral surgery. Ended up got a little bit busy, but revamping that. Yeah, just got back from work. Florida Craniofacial Institute. A quick little recap about me. I'm a fourth year dental student. I have a little bit of a story in terms of that. First semester, my mom actually passed away, and so unfortunately that happened. But I was very fortunate enough to continue to go to school. Later down the line, fast forward to fourth year, we had another family emergency, and due to that, made the very difficult decision to come home, help out with family for take a leave of absence. The dean was very, very understanding and allowed me to take this year off. Having said that, it's been one of the hardest decisions I think I've ever made in my life. It took such a hard time, a lot of commitment, a lot of work to get into dental school. So to take the difficult choice of stepping out for a year, probably the hardest choice. Having said that, don't regret it for a minute. Back home, it's about 5 months into my leave of absence. In the meantime, have interest in oral surgery, so I applied to a bunch of jobs, and I was very fortunate enough to get hired on with Florida Craniofacial Institute. Having said that, I am a assistant there, but yes, coming home from work.
Yeah, man. And so what was work today? You mentioned something about the by the way, I mean just so much going on, and I'm sorry to hear how the all these events. I don't want to, touch too much into the nitty-gritty and the details, but I mean, you're coming out of it stronger, and obviously, it's been a while since we chatted last in that regard, but you're taking a lot of steps forward that are really impactful. I know it's going to impact you and your course later down the road in a number of ways. I could confidently tell you that right now. That's guaranteed. It's just unfortunate, the little speed bumps and big speed bumps that you hit. We can't ignore that. But what was it called? The dance. The dance is the right.
Yes, yes. So, having said that, when I applied to the job, they originally wanted me to have a dance certificate, and dance is with two A's, dental assistant anesthesia nurse certificate exam. Assistant anesthesia comes first, but either way, what it is you have, you're running an office as an oral surgeon. You're running your clinic, and you should have two assistants in your office setting. It's not legally required by law, but Dr. Pat Ricaldi, the way she has her practice set up, she really, really prefers and kind of set a standard for the office to have the certificate. Now, what is this? The certificate is basically you have a sponsoring oral surgery office or dental office, either one, and they sponsor you. It's ran through the AAOMS, and having that sponsorship, you then study the material. They give you a booklet. You study all this material, and it's going over drugs, it's going over sedation drugs, it's going over complications, it's going over general history, diabetes, hypertension, heart failure. How do you deal with patients of that nature? At the end of, I think they say their recommendation is 90 days. Again, don't quote me on to the details, but the overall idea is you then take an exam at a proctor location, and if you pass, you get something called that dance certificate. Now, at that point, now you're a assistant who's trained to assist in the anesthesia part of the sedations. So how does it look practically? The doctor's running the surgery, they're drawing up the drugs, they're making the choices on when and where to push and whatnot, but you are the lead assistant monitoring all vitals. You're making sure the IV's running clear, you're making sure the heart rate's doing well, push a profile, what's happening with the blood pressure. You're in tune with all of that, and you're giving the doctor feedback, you're giving the surgeon feedback. You're saying, hey, heart rate's a little low, hey, not breathing. So then you take a look at the chest, everything that you would be, I think, trained in oral surgery residency, but now you're getting an assistant with a sort of an understanding of what's going on in the sedation world. And that way the doctor has an ease that, like, hey, there's an assistant in here who has been trained, went through all of this, and they can more focus on what's at hand. And I think I think that the anesthesia world, I mean, this is my personal opinion. I'm a fourth year dental student, but I do see it very realistically going in those steps in terms of oral surgery. Just the always the question of, oh, they're also doing anesthesia. Well, if you can say, hey, I have an office and I have X amount of assistants for all the surgeries we do, and they're dance certified, I believe that that's the way that it'll be going in the future.
I like that. I like that. At least the head assistant needs to be dance certified, because then they could kind of lead the ship with the sedations, with the assisting, with the other assistants. That could be huge. I totally agree with that. That's really important. Let me see the logo there.
Yeah.
Florida.
Florida Craniofacial Institute. So Dr. Pat Ricaldi, I don't know if you've in the cleft and craniofacial world, I mean, down here, at least in Florida, she's been that whole experience. Like, thank you for your condolences, by the way. I appreciate that. But having said that, there's just blessing in disguise. And out of such like such a maybe hard moment for her family, it has been one of the biggest blessings to be able to work for her, because she does a lot of cleft, she does a lot of craniofacial, but she also does a lot of orthognathic. I think her practice is one of the few, at least that I've, in my limited range of motion, have seen that she is predominantly, medical, in terms of like she's running orthognathic cases. She's got 2 OR days, and she's very, it's just amazing. And so like she's also has a fellow right now. And so as she's training this fellow, they're talking about measurements, they're talking about facial thirds. I've learned so much just absorbing it from the side, because as she's teaching the fellow, I'm over there scribing for them, and I'm just listening to all this information, trying to process it, piece together, ask my questions. And it's just been an absolute amazing time for me.
When you take the CBSE, you realize that you're going to be literally years, minimum months, but years ahead of other residents when you start residency, right?
I would love to, I hope that is the case. I'd love to look at it that way. On July 19th is the scheduled date
19th.
for that. So
How's the studying going? Because you're working
it's
now, and you were saying something about a pause of classes. Is that correct?
So yeah, well, due to that, in September, I believe, I took a year leave of absence to
The year.
actually
Okay.
come.
I didn't know if it was the full year or okay, got it. Yep. Yep. So
Correct.
you're going to be basically like going into D4 technically now, right?
So I was actually 5 months into D4 year, and then in the middle of that is when the emergency was brought up. I had to make that very quick decision, and so when I go back, I have about 7 months left, and so that will be the CBSE is in July, and then I go back October 1st.
Oh, you go back October 1st to finish up the year, and then it sounds like you're going to need to do like a gap year, if you will, because you got to get the applications in at the end of the year, right?
Well, technically, I don't yet. Well, no, it wouldn't be a gap if, all goes well when I come back in. So my graduating was scheduled to be 2025, and now I'll be graduating in 2026. So having said that, with the test and the application, as long as I send them in before,
Yeah.
their deadline's correct, I would just be, I'm overall a year. This is, this is a year setback, but once I get back into school, as long as I have everything turned in and submitted, I'll just be able to transfer right from dental school to a program pending I get
Oh, yeah,
accepted.
no, I completely follow now. So that means that you're going to be going into it. I mean, that exam needs to be the last piece of your application. So your entire application needs to be going in. It's only early April. You should be working on that personal statement right about now, right? You should be starting to gain
Hmm.
some drafts of that. Start working
Hmm.
with that attending that you're working with. Maybe get some insight from the fellow that you're working
Hmm.
with as far as personal statement, right? Letters of recommendation from your faculty, even though they haven't seen you in several months.
Yep.
And then the rest on, is it the pass portal still?
I believe so. I believe so.
Got it. Got it. Okay. Okay. So, I mean, you know what you got to do. All of that, I would say, if you're taking it June 19th, I'm sorry, July 19th, June 19th, May 19th, if you could try and get all that stuff in by the mid to end of May, that gives you a solid 1.5 to 2 months of solely CBSE focus, right? Are you going to be working? Does that, yes or no? Do you agree
Yes.
with that?
Yes,
Are
I
you going to be
agree.
working during that time?
So what I told them is that I can only do 2 days out of the week, and then the rest of the 5 are just crunch for
What do they
CBSE.
think? What do they think about
With
that?
that, they're okay. When I first on was hired, I explained the situation that I'm here for a year, and that this is the time that I have. And they're, from the get-go, they understood. And, they understand the final pathway too. They always ask,
What did they say about that? What did they make any? Did they give you any recommendations? Is what I'm saying.
who are we talking about? Work for not working, or they were okay with, they understood that I have to take time off for the CBSE. And so they ended up, that was not a problem.
So I know what one thing. I mean, did any of them say don't work and solely study for the CBSE? Did any of them?
So that was the surgeons themselves. I didn't have necessarily that conversation with. It was more with the office manager. I would imagine that they would.
They're not going to know. The office manager is not going to understand that. They didn't take the
Right.
CBSE. They didn't even go to dental school. I would, if you can, and I think it's very fair to do that, to have that conversation with the attending, the doctor, the fellow, to get their insight, right? Hey, how would you go about this? I have X amount of time before the CBSE. Have you taken it yet?
I've taken it once or twice, 2 times now.
Okay, so you know what to expect, and you know how much
Yeah.
studying that takes to get this last score. This is it. This is it for you. You don't want to take it again in February. You got to repeat the whole. This is it.
Correct.
So I think it's very fair to have that conversation with them, and just without getting into the timing, the days off from work, how much time to study, I would just kind of broach the topic, like, what would you do in the situation, kind of thing. You know what I mean? Do you need to work for finances? Like, how is this kind of translating?
Well, yeah. So to take a year off has been, I'm still paying rent for my apartment with
Right.
my roommate. So the finances part is the reason. If it wasn't for that, if I had some sort of means of funding, man, I would just every day. But
What about
unfortunately,
your roommate? What does your roommate do?
so he was in dental school. So the roommate that I had, so
Yeah.
the location, so LECOM, on the 4th year, you are, shipped out to either Erie or Destin, Florida. Not Destin, Defuniak, but everyone knows Destin, Florida. Having said that, I got an apartment there that I'm continuing to pay for until our graduation, which is coming up in May. So having said that, every day that's occurring, a cost there, and also with the finances in terms of the loan. So if there were no financial constraints, I would for sure, cut ties and have it be. But for those reasons, I gotta.
Yeah, and not cut ties entirely, just because you need to narrow in that focus right now. This is do or die, right? That's okay. Okay, no, I just wanted to make sure that I gave you a balanced kind of analysis of this from my perspective. I want to make sure I consider all the variables. There's a lot of
Yes,
factors at hand here. A lot of factors at hand.
I appreciate the hype. Is definitely needed. So,
Yeah, man. Yeah, man. I'm on your side. You know that. Okay. And then you start back in October. How many? Matt, I think I posted this on Students of Dentistry the other way. Did you see the stats of LECOM? How many
yeah.
students matched into?
OMFS 3, I'll tell you 3 right away. 2, I know. The third one, I'm not sure. I've been kind of out of the loop. I just kind of disappeared from school. So I'm sure some of my classmates will see this pop up and be like, what? So having said that, 2 of them I know very well, very excited for.
Yeah.
I just don't know the third.
Did we get those stats correct on the pre-net mentor map?
When I looked, I believe so because that matched up with our poll. I can't speak about any of the other specialties. I
That's
don't
fine. Yeah.
know, but
I want
you
to.
did post LECOM, and I did see 3 on OMFS, and that looks like it matched up with what we have.
Okay. Yeah, this is because this. I mean, this doesn't help you as much, but for listeners, whatever. Okay. And now, how does this translate to you? Because your class size is about 96.
10, maybe something's changed. When we started, it was about 100. But if you have a 96 number, then
So roughly 100, probably this next year that you're going to matriculate into, and 3 out of 100. At least it's 3. It's not 1.
yes.
Your class size is a big number, so looking at 3% matching into oral surgery, that can be a scary monster right there. Just about as scary as the CBSE itself. But 3, you can be one of 3 next year, right? I'm going to try and look at that as the half cup. It's 3 chances roughly, and it could be more, right? You might match 6 next year. You don't know that, but I'm just trying to look at it from your perspective because that can be very stressful, and I do know how much pressure that is on you, especially with everything else that you've been through this last year. You don't need any more pressure. So I'm trying to kind of break this up into bite-sized pieces. You know what I mean?
Yeah. What about yourself? I had a few questions of my own. Having said that, you find yourself 2 months from being out the door, huh?
Yeah, dude, this was my first week back at the city hospital rotation. That's like our main rotations. You stay. Other rotations generally kind of switch between facilities. The other 2, but this one is like you're at that main hospital. You're in the OR 3 times a week. Clinic every day of the week, more or less. Call twice a month, although now our seniors start to take calls, so now it's just once a month. I was on call last weekend, and this past week was the first week on this rotation. So now only 7 weeks left, which is very nice, and therefore only 1 call weekend left. I can't stand being on call, man. And on this rotation, you're on call, second call every night. So not first call where we go into the hospital for consults, it's second call. So I get the phone calls. I have to call with the talks with the attendings, more of like administrative responsibility, overlook, teaching versus like going in. Although I did have to go in 6 or 7 times this entire year, which is a lot compared to Chiefs going in previous years. 7 weeks left in residency. some interesting stuff came out. It looks like they're probably going to keep this year's Chiefs in another 2 weeks. Most programs don't finish until June 30th. Our program gives you a 2-week grace period, so it's about June 15th. But every single year since I've been here, the Chiefs have left like June 1st. Like that was it. And it looks like they actually are going to keep us until June 15th this year. We'll see how that pans out, but this all just came out today, and they're like
processing it.
Yeah, I'm still trying to digest all this, because the way that it started, the conversation, like the discussion today, was they just sent out an email to the 3 chiefs, and they examined how many days we took off this year, because that's like the 2-week grace period. You're supposed to get 4 weeks off the entire year. But the Chiefs, they need you there for responsibility matters, but also the 2-year grace period, 2-week grace period matriculates into your 4 weeks. So you really only get 2 weeks off. And they told me I took 19 days off. So then I had to go back and do this whole stuff. And I'm like, actually, it was only 15 or 16 days. So that's still kind of within the 2 weeks thing. And I don't know, pretty distasteful to get that. I'd taken today off for like an appointment that fell through. Anyway, just
one of those.
A lot going on. Yeah.
I hear you.
Yeah.
All right, so any interest afterwards in terms of continuing on somewhere, or you're in terms of like maybe head and neck, craniofacial, anything like that?
No, I'm going to do private practice. I signed last July or August, quite early. They generally say, but I've also been looking for 2.5, 3 years. It was 3 years ago I started to just kind of put the feelers out, talk to private practice owners throughout the country, people that work in hospital settings, people that work in office settings, just to see what's out there. Like there's this guy in Green Bay, Wisconsin, who he works at a hospital. I forget the name of it, but the guy's name is Dr. Brandon Newell, I believe that is. And he works at a surgeon-owned hospital. They don't have that anymore in the U.S. I didn't know that existed. So they have like the OR setting that they could kind of shift things around with, but there's also outpatient his own private practice setting, and they have like a couple partners. And I thought that was so cool. Why is that important? Because when you work in a hospital here, your bosses, most literally, when you're a resident, for example, like the nurses boss you around, because it's like, it's their clinic, their boss is another nurse. They don't work for you, they work with you, which is fine. It's not like they work for you, like the whole doctor nurse thing. But it creates a sense of like entitlement and power hierarchy, where that kind of, some doctors can be mean and they could like order around nurses and stuff. So it kind of mitigates that. But from the other hand, it's like, guys, we need instruments in the clinic because we're doing surgery. We don't have time to be looking around for instruments missing. But now the nurses come down and they create these sterility rules, and they have cabinets in the hallways now, which now becomes a fire issue, but no one talks about that. And now it's like you're middle of taking out a tooth or doing alveoloplasty, and you're like, can someone give me a bite block? Because they don't have it in the trays, because the nurses made the rules, not the dentist doing the surgery. I could go on and on about this. But So lo and behold, what I'm getting to is that I think having a surgeon-owned hospital really, unfortunately, the power, if you will, could kind of switch and kind of make it like, maybe not as great for nurses, but if you get good people in there, I'm sure the nurses they love working for certain doctors. But as far as in terms of surgery for the patients, it really gets things to be most efficient for the surgeons that way, right? Because they're the bosses. They own the hospital. Anyway, just my 2 cents, and I didn't know that existed. So yeah, I'll be going out into private practice. I start on August 15th, and so I'll be graduating in sometime in June now. Yeah.
Now let me ask that to circle back to kind of the dance, and I don't know if I never, with the strong interest that I had in oral surgery, I didn't even know dance was a thing, but I was curious on your thoughts. You're running your clinic. How important do you think it, and I don't know if you could answer since you maybe haven't been in those shoes yet, but like how important do you feel it is to have a competent team in terms of the anesthesia part of the sedations?
100%. There's not one piece of that 100% that isn't crucial, especially for the sedations more than anything else. You could always argue like the surgical techs need to have some understanding of the instrumentation when you're in an orthognathic procedure, which is for sure. But the sedations you're doing, that's where the patient's life is really kind of great, because in the OR you get an anesthesia team. In a clinical setting, you're keeping patients really light, really light. I mean, so light sometimes they can respond to commands even under the anesthesia, right? But the interrogate amnesia, they're not going to remember it. So from their perspective, they're still asleep. It's generally really safe. The issues really occur when patients don't kind of like disclose certain previous medical history, or took medications and didn't disclose that to the surgeon prior to coming in, or you have general dentists that got like a weekend course certification for anesthesia, and they give a little too much of something that they don't know enough about. The dance is super crucial. If you guys are in the operatory with that type of understanding, it makes everything safer. It really, man, during the sedations, it helps the sedation goes quicker. That could lead to less swelling and inflammation after the surgery's done. I mean, I can only argue for that. I can't even play devil's advocate for it. Can you think of anything? Why wouldn't you want an assistant who's above and beyond experienced and trained, right?
Right. So my thoughts, yeah, and so what I've noticed too, one of the best benefits working as an assistant has been seeing the back office side of things. You know, when you're in dental school, let's say
Yeah.
for instance, because that's the only, you know, the experience that I have. Like you're focused on making sure that, you know, the root is filled, the endo's done, you know, the tooth is extracted, the filling is there's the contacts there, and seeing the front office. Yeah, you run into the front office, hey, can you schedule this? But really, man, it's been eye opening to see the back office of, you know, Dr. Rickard, and she has a fantastic practice, and seeing all of that in play and seeing the struggles. Every practice is going to have a struggle, and seeing the strong suits. And so what I've come to realize is that there's a very like a shortage of people, and I'll hear through there's a shortage of people that are dance certified. So like, you know, listening to the office manager, because we have these conversations, we're trying to recruit more dance, because that's a very strange or not common thing in the oral surgery world, as I understand, to have something like that. So what my thoughts have been in the past is I'm actually in the process of creating kind of a tutoring. So when I was in the master's program, I created a tutoring business, and in dental school, I made money on the side tutoring. You know, I mean, it was like third grade reading and whatnot. But now looking at the
Right?
situation here, you know, there's so many assistants that are ready, and I'm seeing that the doctor's taking their time to teach and tutor the assistants, and I'm just sitting like, I think this is where I'm going, is like I'm working in the process of creating a tutoring / curriculum program for assistants, so that, you know, that the oral surgeons around the offices are like, well, you know, we need these assistants trained, let's get it up, let's get the standard up. And so
Oh, I
trying to
like
create a
that.
program to, yeah, so if, you know, catch me in a few months, maybe half a year, and see where I'm at with that, because that's something that I'm going forward with. And I think that'd be great to come up to offices and offer like, hey, you got these assistants, let's get you more safe. Send over this amount of assistants that, you know, we can only, depending on how it all goes, but the idea is simple:
Yeah.
create a tutoring program for assistants to get dance certified.
I like that a lot. Wait, and dance certified, but then also like maybe within how many years, how many months is dance?
So dance, they recommend that you are with the office 6 months, I believe, before you take the exam. I think that if
Ah,
you go on OMS, that's where it's at. And but I mean, it's been you know, it's been a great experience, and you learn a lot. Now, it was very unfair for me coming from dental school, and when I happened to wear one of my scrubs, and they had, man, pockets for like pens and everything. And so when you go to the proctored location, they're checking all your pockets. And I
mm,
joked that it took more time to get all these pockets checked than the actual exam itself. And then when I was done, she was looking at me very strange, because they're taking pictures, just like taking the CBSE. It's almost like it's not the same. Having said all of that, I just walked out to like 20 minutes later, and they're like, there's no way. She gave me a weird look, but I mean, it's just unfair from a dental standpoint, dental school. Like, they're asking if you're
true.
given like a mandibular block, which nerve are you hitting? You the maxillary, ophthalmic, IAN, or like fibular nerve or something. You're just
Dude, but wait, that's such a good idea. I know dance is definitely supported by Amos, but what if I like this? I like this, especially I'm going to be starting in private practice in August, and I love this. One, it's an entrepreneurial way, but it's actually something we will use, right? You'll be going into oral surgery, into residency in the future. You might have to take a step back, but I could kind of take a step forward and really kind of expand on this, because I would definitely need, and you're going to need several years out, assistants that are on top of their game. You don't have time to be dilly down. God, you're in the middle of a surgery, a sedation. The time is of the essence, and the patient care is of the essence, especially like I said, in the middle of surgery, it could lead to more inflammation and complications. But to have assistance that could take, what if you could get it down to? Imagine you get it down to like a month, like a month, and then
yeah.
like people will pay an out of pocket fee, but like very like acceptable, like a very appropriate fee for the input that you give into the assistants, and then the output that they get, that the practices get. Maybe the practices can sponsor them to do this. Maybe a portion of it is online, or a lot of it's online. I don't know. It's something to consider,
I
because it could
I
it
have
could bring a lot
I
to
have a
others.
small, sorry, yeah, I have a small structure in terms of that. And you know, as I think in oral surgery residency, you don't have the time to like to kind of mess around with that. But the structure that I'm thinking in my head, and like I said, working on the projects. I'd be glad to give an update a little bit later on how it's going. But yeah, that's where I'm at, is creating that to go forward. Because like you said, I mean, if whenever you get into private and you got some assistance, you just hit me up and let me know, and maybe go through, see what program I'm at running at that point. And the
Yeah,
idea
yeah,
would be
even
great.
like
Like you said, streamline it in a way where the assistants, they, you have your office, and again, just seeing in the back, you can tell, like, it's just like dental school. There's kids that want to be there, there's kids that don't want to be there. And so the same thing with assistants. You find the ones that are highly motivated and you say, hey, like, as the doctor, I'm sponsoring you. There's a program, because the
yeah,
dance is a program, and the office does maybe sponsor, I think it was $400 for the entire just the exam itself and the study material. But the study material is like a PDF, it's like a book. So people love to be taught. And so it's PBL's right up our alley at LECOM, but for everyone else, didactic. And there's I think one YouTube channel going over that, but those are just, some thoughts on that.
I'm down. I'm down. I think this would be great. Get it like a separate, like some kind of what is it called? There's like a course. There's some online course. Yeah, we could do that. We could block out AI so you can't just chat GPT screenshots. That would be fun. Get it really down to like setting up different trays with different instrumentation per the surgical procedure, how to identify personality of the surgeon to kind of like mold
Yeah. All of
whether it
those
is the
things.
instrument. Yeah, so much.
Reading the room. Yeah. So I think the niche with that would be, quote unquote, oral surgery small, but nonetheless, like something like that up and coming. Because as I understand, there's always and we'll have patients like that come in that the parent is a cardiologist or something, and they're just like, I mean, Dr. Ricaldi and the other surgeons, they're just very well respected in the community. But I could definitely see them coming into a different oral surgery office and saying, well, I don't trust you to do the sedation because you're doing the surgery. So like, having said all that, like, but the more you layer yourself with the safeties, the better you are overall.
Yeah. Hey, let's go into Jaw Ready. I really like this podcast that you're starting.
Yes,
Now, I'm sure with the studying, it might have to take a quick pause, but pause are
correct,
normal and natural in life. It's nothing
correct.
to fret. A lot of people could get stressed about having to take pauses on things. I really get frustrated with taking pauses on certain things. But I think in some, you got to balance the priority. Sometimes you just got to push through it and get it done. Sometimes you got to evaluate and say, I need 120% attention on the CBSE, for example, right? But talk to me more about this podcast. My goal was like to have this recording. We could post it on your podcast. I'm going to post it on mine, Dose of Dental. We could do like a big,
Yes. The podcast is already. I'm on Spotify. I think that's one of the major ones that I'm on right now. But the idea is simple. It is to create a path for other students who are interested in oral surgery. Now, maybe it'll evolve down the line and go maybe a different route. And who's ever maybe listening can go along. But the general idea is, if you're a student, if you're somebody who's maybe first pre-dental, even doesn't matter, if you're somebody who's interested in the oral surgery pathway, this is the channel to be at. So the idea is to speak with surgeons like yourself to kind of get your input on certain key topics, key questions, like what's a good way to stand out, to maybe program directors, what's etiquette in the OR, because all these things that you of course have learned, I've experienced a little bit, but with a grain of salt. I haven't matched into a program yet, but nonetheless, like, enough information that they have a foundational, okay, this is where I'm at, this is where, and I know you do that very well. Having said that, very happy to have you on. I'd love to get Dr. Pat Ricaldi on there, Dr. Mark Tucker, who's another great, just the amazing thing about it is how you spend time interacting with wonderful people, learning about them, speaking, networking. That's just something great too, because, life is life. And if you have the time to speak with, the ideas are just transferred over, like, even that little thing that we had with just dance just now. I think that's amazing. I think that's just so important in the overall field of oral surgery. And I just want to, again, haven't mentioned to any program, but since middle school, I kept telling everyone, I'm going to be an oral surgeon. I'm going to be an oral surgeon. As time goes on, I just love the field so much. I just want to provide some sort of value to whoever may be, even if it's one person who listens to this podcast, get some sort of great idea and somehow helps their journey. I'm all for it. Now,
and
it's
you
not,
will, man.
Yeah, appreciate that. I
You will,
really
man.
do.
You will get in. You just got to get that CBSE out of the way. You're going to be just fine. I really like the concept of your podcast. I love the intro. I think you're off to the races. You just got to get content on, and it will take a pause for a little bit. But then as soon as you finish that CBSE, literally that night, you want to hop on for a podcast, you let me know. That's another thing too. The one thing you didn't include there is the conversation. The idea of the conversation, I think, is so I really appreciate it because no two conversations are the same, you know?
Mm,
And like the next podcast, we might be talking about an angle of a different concept or a
mm.
different topic. Today we've talked about dance. We're talking about this at the beginning of your podcast. We're talking about the importance of assistance and sedations and surgery. And the next conversation will be different. The recording can always, that will live in perpetuity on the internet. There's a lot of beauty to appreciate in the podcast. Yeah, and then a part two, different conversation, and you just keep moving forward. It gives a lot of exposure to different ideas.
So having that train of thought, let me ask you a question. And as one of the key strategies or key things that I've mentioned in the intro for mine, what would you say program directors are looking at? So for, say, the audience right now is a student who's listening in, they got to this part, they don't even know maybe what dance, they got to this part. What is a program director looking for at, what have you maybe heard through the grapevine or even noticed yourself that they're interested in, like, hey, this is the resident that I want in my
Something that came up recently, not an actual topic directly spoken about, but what I took from it was confidence. It's so tough because some people come in with what they think is that they're confident, and they're actually quite arrogant. They're actually quite, no self-doubt kind of thing, but not being too forward with that. You don't want to come in arrogant or egotistic. So it's very, very easy to confuse that. But generally it's being patient, it's being respectful, it's having a good attitude always, day in, day out, and recognizing mistakes at all. But I'm thinking in terms of like a week externship. Oh, like, hey, can I pour up those models for you? Do you want me to help with those impressions? I do impressions a lot more. I know in residency, sometimes it might help if you go work on higher level stuff. Let me get this out of the way for you. Just give me 20 minutes and I'll get you 2 sets of models. You want me to scan up that? You want me to do the intraoral scan while you can get ready for the measurements of the intraoral, orthognathic evaluation? Or, hey, I see you're about to do a sinus lift. Do you need an extra hand? Do you want me to get some materials for you? Can I assist for you? Just little things, they go so far. And then also you got to be very respectful. You don't want to step on any toes, but also understanding how residents, they have so much on their plate. There's so many responsibilities. No one slept probably through the entire week. No, they did, but like, quote unquote. So just having that understanding and then recognizing where you kind of fit into that mix with a good attitude at the same time. Yeah. And I think that comes down to confidence and self-awareness above all.
Yeah, I think that notoriously oral surgeons, or at least the kids in dental school, including myself, maybe get very, I think there's a underlying thing like, oh, there's always cocky, they're always like arrogant. But to an extent, I do, from what I've seen, the surgeons that are really great, they have that, like you said, not mistaking it for arrogance, but like and you need that. Like, I mean, I've only done sedations, 4 or 5 months, but even in that short amount of time, there's so many times where you got to be quick on you got to be very certain. And I can, from what you're saying, I can imagine that is a very, important characteristic, to be confident in what you are doing. So,
Yeah.
and I do my just comment on that is with just being as helpful as you can. I've noticed that too. And I think that, it's not always maybe to the director that you have to be. I just remember like I used to work with my dad. My dad, he's a construction painter. We paint houses in Florida, new construction. I mean, in the heat. And he would always tell me, if you saw me standing around, he'd say, and he'd be spraying with the hose and whatnot. There's a hose that runs to the electric pump that's in the 5-gallon. If he saw me with my arms folded, he'd be like yelling at me, he'd shoot me out. He's like, you pick up that hose and you hold it. And so as I'm standing there in the Florida sun, he holding this hose. But that instilled something in me, like always be doing something. So that was me. And so like, there I was at an externship at Nova, and they were all, there was downtime. Like I could easily be standing there on my phone, this and that. And not to hype myself up, but I just realized like what you're saying, the practicality of it. Like, and I just started wiping chairs like with the assistants, like nobody even else was looking. And they were so appreciative. They were like, we're putting in a good word for you, this and that. And it's just like, you just never know the smallest things. And to whoever it is, once I was washing my hands in the bathroom and I saw this gentleman over, and I didn't take the time to say hello. This was during dental interviews. And it was like, I didn't take the time to say hello. And I was just like, checking. I'm just like worried about how do I look as appearance. And he looked over at me, and there's a moment where I could have said hello. He ended up being someone important. And I didn't take, not that you just got to put on a fake face for everybody, but you just have to be like, from what I've realized is it goes a long way in life, is just to do your best with everything. And so it gets noticed when it matters. And, it happens.
Exactly. I couldn't have said it better myself. It's so funny. And, I got to keep myself in check because now I'm kind of like the chief resident, quote unquote, but I'm a last year resident, right? Couple weeks left now, several weeks left. And I have to really direct the clinic. It's my responsibility to get that clinic going. We have other residents working in the clinic, but I have to kind of take a step back and say, we have a lecture at this time. We need to get this case moving. We need to work this patient along, and just managing several things at once, right? And helping out the other residents in that clinic. Yeah, this came up recently where I really want to get in there and get in the trenches with other residents. Nothing is below any of us, just like you said, turning over chairs, wiping down the chairs, putting the covers on, working up the smallest little case or seeing a consult follow up here and there. But also being careful because I don't want to come off as like a jerk or having a bad. Very recently, there was like a dental student who's starting to work up a patient, and patient's here for an extraction, right? It's one tooth. We got to get this worked up and get going. And the dental student was like, yeah, but the patient's here asking about her lower teeth. Like, when are we going to do work on the lower teeth? And its extraction visit is not the consult visit. It's completely separate, and it's very problem focused. You're here to have that tooth taken out, and you can't necessarily, especially like a city hospital clinic, you just had 12 walk-ins. You already have 56 patients on the schedule. You don't have time to be talking. But then also, we have to translate that to the patient. And it's like, look, we understand. But, this is the tooth that was hurting at the last visit. If you have problem teeth on the bottom, we can definitely run it by your general dentist. But today, we need to make sure we attack this problem and get it fixed. And I had to kind of say that. I don't know how she took it, but I was like, hey, the patient came in for this today. We're going to do this today. And we need to let her know we can schedule this for the next visit to address the bottom teeth. I don't know, but so exactly what you're saying is like you don't want to come off as like the egotistic oral surgery jerk.
Correct.
You do and it's also hard for a dental student to understand. They don't really know what other responsibilities you have. They get to go home at 5:00. You have to go around on all the inpatients, sometimes at multiple hospitals after that. You might even be on call. It's give and take. What I'm saying is like I'm trying to keep myself in check because I don't want to say something in a bad tone or with language that you got to like soften up the language a little sometimes, But
I have so much
there's that.
I have so much respect for any time I meet a surgeon who is in great moods, great shape, because from everything I've seen on externships, you get like going through the 4 to 6 years, whatever it is, like, and you come out as a quote unquote nice person after all of the stress and that. I always have respect for that because I feel like, from my thoughts, again, I'm speaking on my side of not even getting into a program, but I just, from everything I hear, that it's very grueling. Like, it's like you said, no sleep. There's so many things and nobody's trying to get in your way, but it's just like, it really, I think, either makes you or breaks you as a person, my thoughts.
And sometimes you find out they are trying to get in your way. Not dental students, but
what about the trust but verify? Is that a thing that's said in your circle?
Yes, always trust but verify. Literally everything. Just Wednesday work because this is the first week, so every case this week was worked up last week or further previously. So we're just it kind of falls in your lap this week, more or less, right? Except for orthodontic we had Monday, but everything else falls in your lap. You have to trust but verify every single thing. So we're trusting that these are ready to go, but verify. Check that consent form. Check the H&P note. Make sure it's all ready to go. And sure enough, some of them weren't. Some of them had no H&Ps in. Some of the consents were wrong. For big surgeries, removable hardware, we're doing a transcervical approach. So I thank God we got it all organized. That could have been a really bad problem and even a legal issue if you don't correct the consent and the patient's not aware. So it's, yeah. And as far as the sabotage goes, have you seen that Omax face post? He's like, expect sabotage.
Yes.
That's real. That's a real thing, man.
I believe it. I don't get it. Like, yes. So it's funny. I consider it like a little intern year. Like for me, this being at this work for this year, it's funny because except for the sabotage, nobody sabotages goes out of their way, but trust but verify. There's so many times when you're working with certain, just in general, something comes up and you look and like you said, consent's not there or patient photos aren't there before a biopsy. You need to send it out, all these things. And so I'm getting that taste so early, so quick. Like I'm always and I'll look at them and I'm like, hey, no offense. And I just go and I trust but verify. So many times I'm with the doctor. I didn't set up the room and, I'm with there and they're asking for a tucker. They're asking for something. The drill's not working. I was like, man, I didn't set this room up. So you learn, at least for me, I learned real quick. Like you just trust but verify. I can only imagine when you add a little bit of sabotage into the mix, how interesting that makes it.
Yep.
So is it
oh yeah.
Hypothetically,
you don't know where it's coming from. It's not like it's not necessarily like your co-resident. It's not necessarily like your boss. Although it might. It could be from any direction. It could
Wow.
be the head nurse of the clinic. It could be your program coordinator. It could I'm not saying that these are
Yeah,
examples
no.
of. No, I'm just saying,
Hypothetical, yeah.
yeah, literally from any direction.
Interesting. So you heard that if you're a dental student or pre-dental and you're looking into just, kind of get used to that early, maybe I think the biggest thing to get from that, at least for me, is like just verify. I had in dental school, it wasn't a sabotage, but we had a faculty member and he decided to plan with me that he was going to put a post in it. There's a patient came in, number 8, heavy contact, that it was done at school, and that number 8 crown fell off. And so I sat with him and he reviewed the entire and he's like, I have the special way we're going to do it. And he was going to put a post in it. He's going to use a Gates Glidden to clear out the gutta percha. So here we are, planned for the post. It's very unfortunate. He actually passed away. He had some health issues. He passed away, but life somehow goes on.
The attending, the patient or the doctor?
I'm sorry, the prosthodontist at school, that dental school. Yeah, so he passed away, but I continued forward with the case and whatnot, and ended up my best friend and I, the same roommate, we were trying to get into that canal, and it ended up being that there was a post in there, and you could not tell there was a post because of the fiberglass, and it was the way the X-ray was. There was no. And then when the conversation came up a little bit later, we didn't get in trouble for it, but it was just like one of those trust but verify. I sat with him, I watched him, but I didn't take the time to verify that. It could have been a bigger deal, could have been a bigger problem. But having said all that, I was speaking with one of the other clinical faculty, and they said, yeah, like you can easily tell. And then we go through the history of the PAs, and it's clearly there. But in my head, I'm thinking like so.
Yeah, and 50% of that verifying is really just communication. Would you agree?
Yeah. Asking, maybe I would argue 30% is the communication, again, from my point of view. The other 70 is just paperwork, like you said, that consents, all those things, is word of mouth. I guess it depends on who you're speaking with. If it's with other surgeons, residents, this and that, but if it's other people then that aren't as invested, like for me, when I go to work or anywhere I go, I'm like, I'm full in, I want to do my best. And other people, they're just not there for that. The stakes aren't as high for everyone.
Yeah. You'll get there, man. CBSE first. Yeah. Well, technically application in first, like 99%. The 1% is that CBSE. Then after that, it'll be working on your side projects, your podcast, and then starting school again in October. Around August to October, interviews will start coming in. So I mean, all the next steps. It's just hitting them home, all right?
Yes, sir. I really appreciate your time. Thank you. It's been great.
Yeah, man. Yeah, brother.
Keep in touch.
You too.
Congratulations. 7 weeks. That's amazing.
Oh, we're almost there.
Yes.
But yeah, man, I'll see you on the lives. We'll keep in touch, man. Hit me up in the DM. Anything that comes up, anything I can help with, a question, just fire it my way, man. I want to see you through this process.
I appreciate you. You're the man.
All right, brother. You have a good weekend.
See ya.